this talk is going to be about the program itself. If you do have questions regarding the application process, scholarships, deadlines, things of that nature, there will be an email address at the end that you can write to, and I'd be more than happy to answer those questions at that time. Okay, so without further ado, I'm going to pass it on over to Kate. Please do remember that it is about 3 a.m. for her time. So she is doing us all a favor and has stayed up to share some of this great information about this great program that we offer. And it's always one of the most sought after programs that we offer here at OTS. So without further ado, Kate, I'll pass it over to you.
Thank you so much, Brooks. Ladies and gentlemen, people of the world, thank you for delaying your basketball game. Well, I guess the game isn't being delayed. You are delaying yourselves in experiencing it. And I understand Duke culture, that's quite a big deal. So I wanted to give you just a bit of a teaser, a bit of an overview of our course. Basically, we started this course in 2011, and this will now be our 13th and 14th program. This year we'll have roughly 320 students to date. And the entire premise of the program is health as a human right. Why does health matter? Why does access to vital drugs, life-saving drugs, basic healthcare, primary healthcare services, why do those things matter? And what does that health landscape look like in South Africa within our context here? So we touch on a variety of themes through different modules, through formal lectures, through site visits, and through traveling a lot, which I'll talk about a little bit later. So we look at structural violence, we look at different healthcare systems, we look at the history of medicine in South Africa and the history of, obviously, apartheid, and political economy as an underlying concept. And then one thing that's very important, I think, in this course to understand is that it redefines what a traditional classroom looks like, takes you beyond just the formal lecture space. So the idea is that yes, you are constantly learning, but you're hopefully also taking different pieces of your experiences from your education in the United States or where you go to school in the States, in this case, Duke. You are taking that information and you're doing this sort of back and forth process. You're doing this comparison in your head and saying, oh, this isn't as dissimilar as I thought it would be, or this is really, really similar, strikingly so. So we have a variety of different experiences on offer. And I listed a few there. We go to a few clinics, we visit a private hospital, a public hospital, we work with a home-based care organization, and then we also really try to interrogate what it means to seek different types of non-biomedical health interventions. Biomedicine is just one type of medicine. It's not the only type of medicine, and that's something some students really, I think, grapple with during this course. We go to an indigenous herb farm where herbs are cultivated for different types of medicinal concoctions and tonics that wouldn't necessarily fall into a medical sort of umbrella as such. And then we also have many different lectures on infectious disease. Infectious disease makes up one of our major learning topics. So I wanted to just share with you a few photos. These are some of my photos. They're not really fantastic, apologies, but just to kind of walk you through, provide you some visuals. We all arrive together in Johannesburg, South Africa. This is really your chance to get over your jet lag, as well as to visit different museums and different centers we have here. We go to the Apartheid Museum, which is obviously pretty central to our history and our identity as a nation. We go to Constitutional Hill, where our constitutional court is. And then we also go to the National Center for Infectious Disease and NCID, as well as the Origin Center. Oftentimes, we also switch it up with a reproductive women's health clinic as well, but it depends on which course you're on and if they have availability to schedule us in. So we spend a few days in Joburg. You guys get over your jet lag, hopefully, and then we start traveling up country. Now, something that's really important to understand is that on this course, we travel a lot. We travel basically every week. We spend a minimum of a week in each site. other than Johannesburg, of course. So this is a photo of us driving up the road. And this road is long and winding. It takes us from Gauteng province, where Johannesburg is located, into Limpopo. Basically, within this course, you're in 3 different provinces in one trip. You're also in a few major cities, Nelspruit being one of them, Johannesburg being another of them, and also many, many towns, and some that are obviously not so major. We have different types of transport that are utilized. We have big minibus taxis, or combis as we call them here, which we travel in. But when we get to more rough terrain like this, and especially when we're in Kruger National Park, we're on this rough terrain in GDBs. So when we get to Hamakuya, Limpopo province, this is actually just a few people moving house, as it were. Hamakuya and this part of Limpopo, which is up north, it's about 15 kilometers south of Zimbabwe. It was a former homeland or Bantustan during apartheid. Most of those residual effects from apartheid are still very visually and visibly present, so it lacks major infrastructure. We have been working there for over a decade with our ecology, biology programs, as well as global health, with an organization called the Chulu Trust, and we work with them for home-based care education. They're also a part of our homestay program, and then also they are sort of our base camp. And I wanted to not spoil I didn't want to spoil anything for you there, because it's something that you have to see it with your own eyes to believe it. But we spend about 9 days there. This is one of the groups that I actually supervised last year with their translator. This is during their homestay time, when they were doing basically observational research for putting together a research proposal during the homestay. And this is part of the homestay experience. Not only are you eating local Shivenda food, you are getting dressed up in your Sunday finest and cruising around, observing your surroundings, potentially speaking to people about what they see as health issues, or whatever your particular area of interest is for your group. That's something that is designated during the actual week leading up to the homestay. So everything is put in place beforehand. It's really hot up there. It's something that I want to just harp on for a second. You're going through many different miniature biomes. South Africa has wildly vacillating climate. Johannesburg would be fairly chilly, pretty cold. And Hamakuya, close to the equator, it's going to be much more warm. We then carry on from there, back on the road, and we go to a place called Wits Rural Facility. It's a research facility for University of Johannesburg, Wits University, as well as University of Cape Town. Different researchers come here and do a number of types of research. They can be health oriented, they can be environmentally sort of oriented. And this is a place called Bushbuck Ridge in Mpumalanga province. This is actually just yet another shot that I took from a home-based care visit. So this is where we see home-based care. We actually spend a lot of time with non-biomedical practitioners. Sorry, if you hear that crying in the background, that's my dog. He's upset about something. Sorry. No, Leo. Shh, shh, shh. We also have a few days built into the trip that are free days. This is one of our groups from last year. This looks like course 1. This is a place called Blado River Canyon. It's important also to just mention that we do have a social committee that we asked to establish within the first week. We also have a student representative council, or an SRC, that is part of sort of the everyday rhythm, whether it be academic concerns or just sort of more personal concerns, I suppose, or social concerns. We do recognize that the academics is really only one part of this trip. For me, it's not to say that's not the most important part of the trip, but I think one of the great things about OTS is that it's personal growth, but it's also academic growth, a little bit of everything. And then we spend, after that, 7 days in the Mpumalanga province, Bushbuck Ridge, Wits Rural Facility. We move on to Kruger National Park, and this is really also one of our favorite one of my favorite places. I'm lucky because I get to spend a substantial portion of my year here. This is actually Lawrence Kruger, who is our South African director, in the background in the khaki in the green. Kruger National Park is arguably the most prestigious national park that we have in South Africa. It is an international destination, and you all have the opportunity to live here with exceptional access to different types of resources. This is an ethnobotanical talk that Lawrence is giving, basically how people use different types of phytocompounds and ethnobotanical products, how they make them into medicine and what they can be used for. This is really, this is the last week of the program, yes. So we go on a lot of game drives in the early morning. In the afternoon, we go for Sundowners, which is a nice little spot on this really big lake, basically infested by hippos and crocodiles. Beautiful, and bird life. And Kruger really represents sort of the not only the rise and the crescendo of academic deliverables and all the projects, the research presentations, the final last gasp, last ditch attempts with academics, but it's also a lot of really special time spent together and doing a lot of game viewing, having fun, doing a lot of fireside activity. So I think going to leave it there. This is actually a shot of the very place I was just talking about. It's called Lake Panic, for obvious reasons. There is the undergraduate at tropicalstudies.org email address. If you have any questions that you'd like to direct to students, I believe. That's all I have for now. I'd be open to taking any questions that I may not have covered. I know I may not have covered much, but that was sort of the point. Thank you.
Great. Thank you, Kate. No, that was perfect. It provides a great overview of the program, where you're going to go, what you're going to do, some of the topics you're going to cover. So now, like she said, we do want to open it up to questions for you, the students. So again, if you do have a question, you're going to take your cursor to that lower right-hand corner of the screen and click on that 3 dots, and then select the raise your flag option. Any questions out there? I'll wait and see here. Just to kind of give you guys a brief overview of kind of the deadlines that are approaching here, while we get some students here to get over their cold feet. We have about 3 weeks until, a little less than 3 weeks till the application deadline. So the program is currently filling up. So we will continue to accept applications until the 1st of March, unless it fills beforehand. So do not wait until the last minute to complete your application. And again, some of those requirements are, a semester of college level biology or related coursework, minimum 2.7 GPA at your home institution, as well as good standing at your home institution. So if you do have any questions regarding that, whether you meet those qualifications, you can email that email address that is on your screen, undergraduate@tropicalstudies.org. And let's see if we've got any questions here. I don't see anyone that's willing to step out and ask a question here. I guess, Kate, that means that you covered everything. There is nothing. Okay. Well, if there is no questions to be asked, I'm sure I'll see some. You can always email me afterwards. And if it's a question for Kate, or maybe it's a question I can't answer, I'd be happy to forward it on to Kate as well. So
yeah, absolutely. I'd be happy to receive those.
Great. Well, thank you again, Kate, for sharing that with us. Thanks to all the students that joined us. We are recording this as well. So if for whatever reason you logged on late, the next day or two, I will post a video recording of this on YouTube, and I'll share it with everybody that has registered. So that way you can review the talk as well if you missed anything from the beginning. Okay. Well, thanks for joining us.
Great.
Everyone have a good evening, and good morning to Kate.
Thank you. Bye.
Bye-bye.